Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show, the 2020 edition. Wow, January 7th, we're already a week into the new year. Boy, it is flying by. So I can say Happy New Year because I haven't talked to you this year. Been off the last few weeks, but look forward to bringing you a ton of, doctor interviews, health information in 2020. So we're going to start right out this evening. We're going to do a little bit different. We have a neuro interventional fellow, Dr. Anthony Alvarado-Ortiz, who's going to talk to us a little bit about that designation and the program, and of course stroke, which is prevalent in not only the older population, but now we're seeing, and I'll let him talk a bunch about this, a rise in the younger population as well. So without further ado, I want to welcome Dr. Anthony Tony Alvarado-Ortiz to the program. Dr. Alvarado-Ortiz, how are you doing this evening?
I'm holding in there, David. Thanks for giving me a call.
Thank you, and welcome to the program. Thanks for calling in from Hialeah. I thought we'd start out a little bit about the Neurointerventional Fellowship because you have the distinction of you're the first interventional neurology fellow for the Advanced Neuroscience Network, which is part of Tenet Healthcare. It's all the primary care and primary and comprehensive stroke centers in South Florida. So that is an amazing distinction. Tell us a little bit about how that opportunity came about.
Well, it's fascinating. I was actually completing my vascular fellowship, which is also a lot of critical care, over at Tulane at their main campus in New Orleans. And there I was learning the ins and outs, or specializing, if you will, in stroke care or vascular neurology. I'm a board-certified neurologist, and I went there to really expand a knowledge base and focus on this disease state. And while I was there, I was looking at, well, where do I go from here? Do I triage, if you will, and then do further management in a critical setting, or do I take the helm and actually do the procedure that it strickens those with the most morbid disability and often very mortal consequences, and that's neurointervention. So we have two therapeutic modalities in the short window when someone starts initially having a stroke, and that is A, with a medicine that helps the body's enzymes break down the clot, and then B, with a surgical component where we mechanically disrupt the clot with various techniques. And so I decided to take the surgical option because I'm one of those go-getters.
That's great, and we're glad to have you here in South Florida, and we're going to get into all that. Let's also talk a little bit about, so you're under the tutelage of Dr. Ritesh Kashaw, the National Stroke Medical Director for Tenet Healthcare. That's for all of Tenet Healthcare. that's amazing to be, have the opportunity to work with him. He came to this area in 2013, and we've talked to him on the show, and we've talked a lot about door to needle times and the improvements he made there at Palmetto General Hospital and for stroke care in Miami-Dade. So will you talk a little bit about working directly with him on these like you said, these really tough cases?
A very special relationship to me. When I was doing my residency here in South Florida, I had the opportunity to be one of the, actually like first or second, really the first resident to work under him as at least a neurology resident, and spent a fair number of years just idolizing the man and modeling what I wanted to do in my career, but also where I was going to take that career as far as how I wanted to leave my mark on the world. He is such an impressive force, and what I mean by that is his interest is more than just the single patient that he sees face to face every day, but it's also on improving the system of care that we work with to do the most good for the most people. So this relationship really started when I was at Tulane, and I reached out to him saying, hey, I kind of have this opportunity, but I don't know where this is going to go. And he said, Tony, we've loved having you here. We'd love to continue working with you. Come down here and join this fellowship program where I just want to get this started because the system needs more neurointerventionists. We've had this great advance in technology that now allows us to go after these most morbid and mortal-causing strokes, like I had mentioned earlier. And the technology is dramatically underused. There's so many patients that can get benefit in this, both as a life-saving maneuver, but also in de-escalation of their disability, which is what we see as being one of the most costly features of stroke. Is that after you've had the stroke, how disabled are you, and how functionally able to interact with society and service yourself, etc. And this technology really allows us to put the odds more in our favor. And there's just not enough of it. There's just not enough of this specialty out there. And so this fellowship is part of his greater plan to launch these specialists, including myself, or more of them, into the community of DNA. We're starting with tenets. So the idea is that we create a framework that others can model themselves after.
That's great, and we're going to talk a little bit more about that technology. We're here with Dr. Anthony Alvarado-Ortiz. I know him as Dr. Tony. I've gotten to know him a little bit, and so we're going to talk a little bit more about the interventional neurology care that's provided here in South Florida. So Dr. Alvarado-Ortiz and Dr. Ritesh Kaushal that we just were talking a little bit about are part of the Advanced Neuroscience Network Physicians. It's ANNphysicians.com if you want to take a look and learn a little bit more. They're both on staff at Palmetto General Hospital in Hialeah. You hear me talking a lot about that hospital. It's an amazing hospital in Miami-Dade County. The website is palmettogeneral.com. Numbers 888-620-1932. Dr. Alvarado-Ortiz, that is Palmetto General Hospital is a comprehensive stroke center, correct?
Correct.
Okay, great. Yeah, that's that high level of stroke care. So what are some of the most common type of interventional neurology cases you see into the hospital? I mean, what are you seeing the most of that need that type of interventional neurology care?
Of course. So our bread and butter, if you will, is the mechanical thrombectomy. And this is where we use either aspiration or a stent retriever, which is a stent much like what we use to open up a coronary, but we use it and it's tied down or tacked down with a wire for which it can grab onto a clot, and then we can retrieve it out. And we use both aspiration and this separately or together. And the idea is to pull the clot out mechanically versus using medicine to help dissolve the clot. So this is our bread and butter. We see the most of this, and we probably see almost a case a day As we get better at recognizing this type of stroke, we just find, oh my goodness, we were just missing the bar on the incident. So it is definitely something we do a lot of over at Palmetto, and we're quite sufficient at it. And Comprehensive Stroke Centers, as it is an accreditation or a status that's measured by various accrediting bodies. We are JACO accredited, which means that we can take care of all the most complex of neurovascular care. This includes having a multidisciplinary team of neurocritical care, neurovascular, neurointervention, and neurosurgery. The other things we also deal with on a common basis is aneurysms or vascular malformations. And this is where someone, heaven forbid, has a bleed in their head, and we able to isolate that bleed etiology to being a aneurysm, which is a change in the shape of the vessel so that its walls are weakened and it ruptures and such needs to be secured. And we have various techniques for doing that. And that is another big component of what we do at Palmetto.
We'll talk a little bit more about the types of stroke and aneurysms as well. Can I go back a second, though, to that stent retriever? So I saw them in the past. Does it have like a coil or hook? And this is part of a catheter-based treatment. Is that normally through the groin or other areas interventionally? So this is not open treatment. This is done right through the blood vessels?
Correct. So this is an endovascular procedure, which means that it happens within the lumen of the vessel. We enter our workhorse, if you will, is the femoral artery. We tend to go to the right femoral artery. Just because the caliber of the vessel is larger, we go through there with various catheters and wires in order to safely gain access to the vascular lumens of the brain. And we can also use the radial artery or other distal vasculature, but we tend to use that right femoral the most often. It is under the greater umbrella of the minimally invasive procedure. You could have it has the same risk profile of a cardiac intervention or heart if you were to get a heart cath.
I see. So yeah, it's in that same realm. And then the clot is retrieved via like a coil system and then brought out of the body.
So the mainstay technology is a stent. It kind of looks like a Chinese finger trap, where as it expands, it opens up and has these various cells in the mesh that can grab onto a amorphous tissue or a clot or a thrombus, and then as it is compressed or pulled through a catheter, it shrinks down much like a Chinese finger trap does when it's compressed. And it is tacked down on its proximal end with a wire, which allows us to tether it in and bring it back down through the catheter system.
And then once that clot's brought out and the patient starts recovering now, is it normal protocol? You would send that to the lab and kind of study the actual clot, or is it just that part of it's over and it's focused on, obviously the patient recovery, which I imagine happens pretty quickly after the clot's removed?
Yeah, the recovery does happen relatively quickly. It really does depend on the extent of the damage that had already preceded the procedure, but there is immediate restoration of flow if we are able to recanalize the vessel. The actual clot itself, there is various institutions that have done study on this clot to further the field and a better understanding of this disease mechanism. But on a regular basis, that's not something we hold on to. No different than, say, like a scab on the skin. Oh,
okay. This is a fascinating description. I thank you so much for taking, the time to be so detailed, because I've asked that question a few times in the past, and that's just an amazing description. So we're here with Dr. Anthony Alvarado-Ortiz, part of Tenet Healthcare's Advanced Neuroscience Network Physicians Group. That's ANNphysicians.com. If you'd like to take a look and learn a little bit more, he works directly with Dr. Ritesh Kashaw, National Stroke Medical Director for all of Tenet Healthcare nationally. They are on staff at Palmetto General Hospital, which is a comprehensive stroke center in Hialeah, Florida, Miami-Dade County. and the website is palmettogeneral.com. The number is 1-888-620-1932. Dr. Alvarado-Ortiz, since we have you, can you talk to us a little bit about the two different types of stroke? I think there's two main different types, right?
Of course. So stroke in itself is a presentation. It is a constellation of symptoms that would suggest that there is an ongoing vascular event. That event could be either a drop in perfusion to the various end tissue, like an ischemic stroke, which is what we call an ischemic stroke, or a damage to the vessel so that it bleeds. We call this a hemorrhagic stroke. There's different types of each of these, but those are the big main groups.
And then another one I've read a little bit about is a TIA. It's a transient ischemic attack. Is that kind of like a mini stroke?
I guess that's a fair way of talking about it. So a TIA in itself is the same mechanism as its ischemic counterpart, except that the symptoms give way to the patient returning back to a complete baseline within 24 hours. Or if the MRI, which is a imaging modality we use that uses magnets and gets a very detailed image of the brain, shows that there was no damage that was done to the brain from said insult. So it basically comes down to that you had an event, but your body's various means of breaking down clots was able to do the job before the doctor got to it.
I see. So we're here with Dr. Alvarado-Ortiz telling us about stroke, and we're going to talk a little bit about aneurysms. He is a neurointerventional fellow. Also, that field is also known as interventional neurology, as well as I've seen it as a neurointerventionist. I think I almost got that right. So there's a couple different types of ways to say that, but they treat, issues with, blood clots in the brain, and then like we're getting into aneurysms. You kind of mentioned aneurysms a little bit before. What is the percentage kind of versus strokes versus aneurysms? I've done a little reading on this. I saw, that interventional neurologists treat probably 85% of the time strokes, and then 15% of the time aneurysms. Is that close at all?
That's pretty fair. About anywhere from 10 to 20% is hemorrhagic, and an even smaller percentage of that has something to do with a vascular lesion that we can fix as physicians. And the big one we worry about is aneurysm, because that is one that we do have the technology to manage, and in the acute phase is dire that we get to it sooner than later, because the patient can profoundly continue to bleed or re-rupture into their brain after the initial event, which could have a mortal consequence.
And so recently, I was a big basketball fan, well, still am, and I grew up with the commissioner of the National Basketball Association, David Stern, watching his 30-year career taking basketball from 1984 to 2014, amazing growth in the professional sport, not only nationally and internationally, an amazing man. And he recently passed away from a brain hemorrhage at 77 years old. He had it in, I believe, around December 12th-ish, if I'm not mistaken, and was in and out of the hospital, I believe. And then they were working on him, and he actually didn't make it. Now, is a brain hemorrhage also an aneurysm, or is that a little different?
It's a little different. Now,
okay.
They both have, to a degree, to deal with the integrity of the vessel wall. And what I mean by that is that there was, at some point, a loss of integrity in that vessel wall, and that for whatever reason, that weakness was the weakest point in the chain, and it broke. In the case of an aneurysm, it is probably some disruption of one of the deeper layers of that vessel wall, so that when the pressure is hitting it in such a way it causes an outpouching or like a ballooning or sacculation, if you will, of that area of the blood vessel. And as it continues to balloon out, the wall stretches and becomes more thin and frail. This is similar to like what you would see in diverticula in the gut, where you have these outpouchings in the GI, and as it continues to stretch, it loses its integrity and can rupture. Now, in the case of this young man, or 77, he likely had what we call a blood pressure or chronic disease-related bleed, in the sense that one of the deep vessels in the brain prematurely aged, and that vessel. How vessels age is they just become more stiff. And as they become more stiff, they also become more brittle.
I see.
It can either crack, it can either crack, and that cracking is inflammatory and turns on the platelets, which is the bricks and the brick and mortar cascade of our clotting mechanism in our blood. And that causes that vessel to collapse. Or it can outright burst. And this is often what is the case in these hypertensive bleeds, is that the integrity of that vessel is lost, and it cracks and then blows.
In terms of treating the going back to the aneurysm interventionally, what are, with when you're treating the type of stroke with the clot and you're able to take the stent retriever and actually take the clot out of the brain and out of the body and, restore blood flow, what is the treatment option for the type of aneurysms you see?
All right, so there's multiple different techniques. It basically is what we call, at least under the gradient umbrella, is embolization. And this is we can achieve this with dropping coils, these pro-thrombotic coils, these long wires that they were forged in such a way that they want to, once they hit the blood temperature, coil in on themselves, and they form little balls. And so they released from the wire, the catheter, and then kind of coil themselves within the lumen or the chamber of the aneurysm. And they're prothrombotic, so clot develops around them, and it walls off or seals off that aneurysm. The other way of treating it is doing the same technique, but using a stent, much like we see in the heart, to bridge or kind of buttress those coils to keep them from slipping out of the mouth of the aneurysm. And then lastly, we also have this technology called a flow diversion device, which is where we use a stent that's more finely fenestrated, and what it does is allows blood flow to go, or blood cells to move from within the fenestration, but it kind of directs the current of the blood away from the aneurysm.
This has been a very informative radio show. Dr. Alvarado-Ortiz with us. We're talking about stroke and aneurysm care. Only have about a minute and a half left, unfortunately. He is with ANNphysicians.com and Palmetto General Hospital. That's palmettogeneral.com if you want to learn a little bit more. Last question, Dr. Alvarado-Ortiz. Why did you decide to become an interventional neurologist or doctor?
Well, I was treating a lot of these patients in the critical care setting, and when you see these patients come in either too late or because of the system of care, they don't necessarily have the availability of this special procedure. The consequences, the long-term consequences, both in disability, the disruption of the family unit, and the drain on resources of someone who has a very fulminant and a malignant stroke is pretty awful to see over and over again. So this is my chance to stand at the forefront of this field and do something about it.
Thank you so much for joining me. I got to have you on the program again. It's been a fascinating talk. I want to thank you again.
It's been my pleasure. Be well, David.
You too. See you next time on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.